54-year-old Roxanne Schlick, who lives outside Chicago, has worked in the medical field for 25 years as a nurse and then a pharmacy technician. She started experiencing irritable bowel syndrome, or IBS symptoms, about 30 years ago.
It was in the late 70s where I started having problems, especially with pain and cramping.
She understood that what she was feeling was something more than the typical hormonal problems that come with monthly menstrual cycles.
Menstrual cramping was more like it felt inflamed, where the cramping from the irritable bowel syndrome was actually like waves of cramps coming on, pain.
Doctors say that a patient with irritable bowel syndrome has a highly sensitive bowel and GI tract. Abnormal or increased responses in GI sensitivity can be stimulated by additional triggers like diet, stress, anxiety, infection, or trauma. Doctors say IBS patients can have various conditions that are similar in nature.
So a large number of patients with irritable bowel syndrome have comorbid conditions of anxiety, depression, stress, and what we know from the literature is that while stress does not cause irritable bowel syndrome, it certainly exacerbates symptoms.
Several years ago, Roxanne Schlick's brother, Bob, lost his life in a tragic hit-and-run accident that devastated the entire family.
And then, just like that, my life in 1975, my life changed drastically. I had to deal with something, it was so painful, just very painful to deal with.
Because IBS is such a complex condition, often a multidisciplinary approach involving specialists from different areas works best to treat the physical, mental, and emotional aspects of the condition. Medicines can also improve symptoms like diarrhea and constipation, and abdominal pain related to IBS. They include laxatives, antidiarrheals, antispasmodics, and antidepressants. It may be necessary to use a combination of therapies for the best possible outcome, including a psychological approach.
A lot of patients are prescribed medication from their gastroenterologist that for some is effective and for others it is not. By the time a patient is referred to me, often the medical treatment has not been sufficient. So my role as a psychologist is to determine what psychological factors may be occurring in their life that may also be getting in the way of their medical treatment being successful. So a key component of the psychotherapy is developing a range of relaxation techniques that can essentially decrease their symptoms of anxiety, perhaps decrease their symptoms of stress.
Roxanne Schlick's journey has been a challenging one, but learning more about what triggers her symptoms, along with changes in her diet and medication regimen, is definitely keeping her on the right track.
I feel much better right now. I have much fewer episodes than I had over, back in the 70s. I finally just recently went on a vacation to Tucson, Arizona, and I want to continue maybe once a year go someplace.
While IBS can be discomforting and distressing, it is not believed to cause any permanent harm to the intestines or lead to any other serious illness.